Hey, welcome. Today, we're going to pull back the curtain on something that's usually invisible, but it's absolutely essential for safe healthcare. We're talking about the detailed system that skilled care facilities use to protect you and your loved ones. Let's break down exactly how it works. I mean, this is the big question, isn't it? When we put our trust in professionals with our health or the health of someone we love, we expect the absolute best. But what guarantees that? It's definitely not just good intentions. Nope. It's a powerful, deliberate system. And that system is what's called a formal quality management program. You can think of it as a promise, really. A public promise from the healthcare provider saying, hey, we're not just delivering care, we are constantly measuring, evaluating, and improving every single thing we do. Okay, so what's actually in this quality blueprint? Let's dive in and break down the core parts and the key terms that these teams use to build a real culture of safety. First up, the term itself, quality management. It sounds kind of corporate, but think of it like this. It's a regular health checkup, but for the entire organization. The goal is to make sure every single department and process is working at its absolute best. So how do they do that checkup? Well, they use quality indicators. These are basically the vital signs of the organization. The quality team tracks them, just like a doctor tracks your pulse or blood pressure. Are patient satisfaction scores high? Are hospital readmission rates low? Each one of these numbers helps paint a really clear picture of the facility's health. Of course, things don't always go perfectly, right? So you've got to have a plan for that. That's what's called an adverse event. Any unexpected thing that happens, from a patient fall to a medication mix-up, just giving it a formal name is a huge first step because you can't fix a problem you haven't clearly defined. Now, a plan is great, but it's only as good as the people who bring it to life. So who is actually on this quality team? The answer? Well, it shows you just how deep this commitment to safety really goes. Just take a look at how this is all broken down. It starts right at the top, with leadership providing the resources and taking the ultimate responsibility. Then you've got the administrator and director of nursing managing the day-to-day. But check out that last row, all staff. That's the real game changer right there. And honestly, this is the most important thing to get. Quality isn't some memo that comes down from an office upstairs. It's an all-hands-on-deck culture. From the person cleaning the floors to the head surgeon, every single employee is expected to spot concerns, report issues, and be part of making care safer. It's a truly collective effort. All right, so we've got the blueprint and we've got the team. But how do they actually find and fix problems in real time? Well, it all comes down to data. This is where the system really comes alive. Remember those clues or vital signs we talked about? Here are some of the big ones. The team is constantly looking at patient surveys. They're tracking every single adverse event. They're monitoring readmission rates to hospitals and checking if patients are meeting their personal care goals. And this data isn't just collected and filed away. It is actively analyzed. And this chart, wow. It shows you perfectly where they get all this info. It's not just coming from one place. They're combining direct feedback from consumers, official incident reports, deep dives into medical records, and even just talking to the staff on the front lines. By pulling from all these areas, they get a complete 360 view of what's really going on. So, okay, the data flags a problem. What happens next? They follow this really clear 3-step process. First, the event is reported and documented immediately. No hiding, no blame game. Second, they find the why. This is called a root cause analysis. Sounds super technical, but it's really just about playing detective to find out what really caused the problem, not just the surface level stuff. And finally, with that deep understanding, they create a fix, a real plan to make sure it doesn't happen again. And all of this, it leads to the real goal here. It's not just about patching up individual mistakes. The true power of a quality management system is creating a constant cycle of learning and improvement so that care is always getting better for everyone. So, what does an improvement actually look like in the real world? Well, an investigation might lead to a brand new policy to help prevent falls. It could show that the staff needs more training on a specific procedure. Or maybe it reveals how a new piece of technology could completely get rid of a certain type of error. These are real, tangible changes that make a direct, positive difference for patients. And I love this quote from the policy because it just hits the nail on the head. It makes it crystal clear that the most important voice in this whole entire process is the patient's. Your feedback isn't just listened to politely, it's actively used to make things better. you are a real partner in improving care.
So the next time you or a loved one are getting care, you know this system is working hard behind the scenes to keep you safe. And knowing this, that's powerful, right? So it leaves us with one final question for you to think about. What would you ask your healthcare provider to understand their commitment to your safety? Thanks for joining me.